My name is Katie Kitchens and this is my bedside assessment video. I have checked the patient's record and the patient is not on bed rest or oxygen. The patient is on standard precautions. Before I enter the room, I would check the doorway for markers or flags that I need to be alerted to. There are none on the doorway. Before I entered the room, I would perform hand hygiene. Hi, my name is Katie and I'm going to be your student nurse today. Can I have your name and date of birth, please?
Dixie Sue, December 15th, 2007.
Thank you. There are no environmental hazards to my patient or myself in the room. On a scale of 0 to 10, with 10 being the worst pain ever, what level of pain are you experiencing today? No pain? Okay. All right. Can you push against my hands for me? Thank you. And did you feel my hands? Keep pushing against my hands. Thank you. And do you feel my hands down your feet? Okay. My patient's motor and verbal responses are intact. My patient is lying comfortably in the bed. Her facial expression is calm and relaxed. Her personal hygiene is neat and clean. Her nutrition, her hydration is healthy. Her weight is appropriate to her height and her fat distribution is even. Her speech and communication are clear and articulate, and her hearing is consistent with the conversation. All right, I'm going to go ahead and shine this light in your eyes, okay? Just look behind me. Thank you. My patient's pupils are 2 millimeters. Her pupils are round and reactive to light and accommodation. She is also, her direct and consensual light reflexes are intact. Can you swallow for me? Thank you. My patient is able to swallow. Her eyes open spontaneously, and she has no ptosis or facial drop noted. All right. I'm going to listen to your lungs, okay? Whenever you feel this touch your chest, just take a deep breath, okay? And can you sit forward for me? Sorry. Deep breath. Thank you. And can you take one more deep breath and cough? All right. And do you have any mucus? Okay. My patient's lungs are clear with no adventitious sounds. She's not producing any mucus as well. If my patient were on oxygen, I would check the flow rate and the source of the oxygen and the fitment of the mask to make sure that is all per physician's orders. If my patient were using an incentive spirometer, I would make sure that she was educated on the use of the spirometer. All right, I'm going to listen to your heart now, okay? You're good. My patient's apical rhythm is regular. I'm going to check your apical and your radial. My patient's apical and radial pulses are the same with no deficits noted. Now I'm going to listen to all parts of your heart, okay? Move your arm for me. And repeat with the back side. Okay, thank you. My patient's heart sounds are normal with no abnormalities or murmurs noted. Can I see your hands so I can check your capillary refill? My patient's capillary refill is within 2 seconds. Okay, I'm going to check her for pretibial edema. There's none noted. And your posterior tibial pulses, +2 equal bilaterally. Dorsalis pedis pulses, +2 equal bilaterally. All right, do you know where you are today?
At home.
Okay, and do you know what month it is? Do you know what season we're in?
Spring.
Okay, my patient is alert and oriented ×3. If my patient had an IV site, I would check it and make sure that the dressing was clean and that the site was good and that the IV fluid and rate were what the physician had ordered. All right, I am going to look at your stomach. Thank you. My patient's skin color is even and consistent. She does not have any lesions or dressings, no skin breakdown, no drainage tubes, or anything of that nature. Her skin is warm, it is dry, there's no turgor noted. All right, I'm gonna listen to your stomach, okay? Wave your hand for me. Sorry. Any pain or tenderness? Huh?
No.
Okay. My patient does not have any abnormal bowel sounds. Normal bowel sounds are present. There's no pain or tenderness at the site. And again, she has no drainage sites or dressings present. All right, are you peeing regularly?
Yes.
Okay, and how much are you peeing?
1 cup.
And what color is it?
Yellow.
And is it clear? Okay. Are you having regular bowel movements?
Mhm.
Are you passing any gas?
No.
Are you tolerating your foods okay?
Yes.
All right, my patient does not need a bladder scan. And based on the assessment so far, my patient is not a fall risk, nor is she a risk for skin breakdown. All right, how are you? Are you moving around okay?
Yes.
Okay, do you require any aids to move, a wheelchair or a walker?
No.
If my patient was on bed rest, I would make sure that the bed was properly positioned and that the patient was turned regularly. I would check the SCDs, the TEDs, and the foot pumps if she had any of them. She does not require any ambulatory aids or any assistance, and she has no difficulty with movement. So again, she is not a risk for falls based on a standardized scale. At this point, I would make sure the bed was in the lowest position, put up 2 side rails as per protocol. I would put the call bell within reach, put the bed alarm if it was indicated on. I would then perform hand hygiene and document my findings.